I apply to insurance companies to represent their products. They then establish my qualifications, whether I'm licensed or not, whether I can meet the criteria that they have for somebody representing their product. And that gives me the ability to present that product as an option to the client. I'm answerable to CMS, which is the enforcement arm for Health and Human Services, and that is who manages Medicare. I work for multiple companies. Some of the big names are Cigna, Humana, United Healthcare, Wellstar. And then some of the other companies are Mutual of Omaha, for example, Philadelphia, a bunch of different companies. Medicare is the insurance plan that people who spent most of their lives working have qualified to buy. The key word is buy, because Medicare Part A you earn, but Medicare Part B is purchased. People contact me who are trying to resolve how to cover the 20% out of pocket that Medicare has, which can go as high as 35%, which has no limit. We recognize in this country that preventative health care is important, and the access to preventative health care and catching things early is by having insurance in place, which allows you to go to the doctor and get your checkups at no cost. A lot of people have family, and the last thing I want is anybody to be standing at a grave going, I wish my mom had had coverage so she could have the cancer looked at, so she could have had this taken care of, and I didn't know. I was uninsured at a period of time in my life. I racked up 2 hospital stays, and between the two, it was about $380,000. Fortunately, I had enough pieces in place to get that covered. But even with just plain Medicare, 20% of that is still a big hit, and it can wipe out a person's savings. I do presentations in Rockdale County. I do it in neighboring counties, in churches and other facilities. My out-of-pocket for healthcare for all of this year, with operations, exams, physical therapy, and everything else, was $208 for medical care. That's it. Nobody's getting that under age 65 that's not on Medicare. But if Medicare is done right, you can be in that position. So I do what I do for people about halfway across the country. And a lot of it is referral basis, where they pick up the phone and they call me, because I do have a lot of clients out there who send me people who are challenged with what they have. So the first thing I'm going to tell anybody, Medicare does not pick up the phone and call you. Social Security does not pick up the phone and call you. So if somebody says they're calling from either one of those two, the first thing you should do is hang up. They want you to pick up the phone to get your name and number and make a lot of calls. I'm not going to do that. You're going to call me if you want help, and I will help you to the fullest ability I have. But I'm not interested in your Social Security number. I'm not interested in your Medicare number, except if it's needed to get you what you need. There are people like myself who are brokers, and what we do is we actually talk to the client and find out what the client needs. My service doesn't cost anything. You're going to get what you pay for. But do you go to the mechanic who just came out of high school? Or do you go to the certified mechanic? Do you go to the person who is already on Medicare and ask how to do Medicare? Or do you go to somebody who just got their license and started selling the product, and all they're worried about is a commission check? I'm actually licensed in 16 states. I'm forming relationships. Most of my people that I work with have been part of my family, because they are family, for 5 to 10 years. I have a car. I will come to you. I will do it over the phone. I can do a Zoom meeting for those people who are concerned about technology and don't want face-to-face. I have no problem at all sitting down with somebody and going through all the different pieces and having the conversation with them. The first step is a phone call. John Spek here, how can I help you? Then we can establish what needs to be done and how. I have email, john.w.spek@gmail.com. I have an office number, 443-393-4097. And anyone who becomes somebody who's calling me for assistance, they get my cell phone and they have 24-hour, 7-day-a-week reach to me. I also have a Facebook page that is set up as Medicare Tips. So there's a lot of ways to reach me, and I don't mind if somebody sees me, recognizes my face, and says, "Hey, John, I saw you on 23, can you help me?"